Hello everyone, this is Katrina here. I'm an occupational therapy student from KU Medical Center, and in this video we're going to talk about post-stroke fatigue and how we can manage symptoms to promote engagement in our daily lives. Post-stroke fatigue is a common condition experienced after surviving a stroke and is characterized by a feeling of extreme weariness, tiredness, or lack of energy. Post-stroke fatigue is a complex experience that many stroke survivors describe as both physically and mentally overwhelming. Many stroke survivors describe PSF as occurring suddenly, without warning, making it hard to complete activities within their daily life. When you think about post-stroke fatigue, think about your brain and your body as having a battery, just like a car, so your energy source. After surviving a stroke, it can feel like your battery starts with less energy than before your stroke. Sometimes your battery can be used up more quickly than usual and can take longer to recharge. When you do rest and recharge, it might not always feel fully recharged. And this is very common for stroke survivors and is part of the healing process as your brain is reorganizing connections. Symptoms of post-stroke fatigue can include difficulty with self-control, emotions, and memory, and feeling tired even after a good night of sleep. Some stroke survivors who experience post-stroke fatigue also describe feeling tired when performing tasks that require physical or mental focus. More than 40% of stroke survivors report post-stroke fatigue as their worst or one of their worst symptoms. Post-stroke fatigue can be differentiated into two main types of fatigue: exertion fatigue and chronic fatigue. The two types of post-stroke fatigue are not mutually exclusive, and it can be difficult to differentiate between the two. So exertion fatigue is related to the physical changes you experience after surviving a stroke, like changes in your cardiorespiratory system and muscle fitness. Exertion fatigue is typically experienced after intense physical exertion or mental effort and is more common in earlier stages of stroke recovery. Chronic fatigue is related to our psychological well-being and experiences of things like post-stroke depression or anxiety. Chronic fatigue is characterized by mental and psychological symptoms. Our mental symptoms are associated with some of those more cognitively demanding tasks, while the psychological symptoms are associated with decreased motivation and a lack of interest in meaningful activities. These symptoms are more common in later stages of stroke recovery. It is important to remember that your individual experience of post-stroke fatigue may influence what kind of management techniques work best for you. In this video, we will be focusing on how to manage post-stroke fatigue by utilizing energy conservation techniques. A valuable skill to learn when dealing with post-stroke fatigue is how to balance activity and rest throughout your daily life. It is important to understand your body and to respect its limits as you use up energy throughout your day. Energy conservation is one approach to managing fatigue by adapting how you carry out your daily activities. The goal of energy conservation techniques is to improve your quality of life by conserving the energy needed to safely engage in meaningful activities in your daily life. The four main strategies we can start with are to prioritize, plan, pace, and position yourself. Prioritizing is deciding which activities are the most important in your daily life. Planning is a great way to prepare yourself and your environment to set yourself up for success. Pacing is an important part of balancing your energy exertion throughout your day. And positioning is a way to make sure your body is well supported throughout your daily activities to make sure that your energy is being directed towards your valued activities. What activities are the most important to you? When we prioritize, we decide what needs to be done today and what can be done later. Consider what activities you need to do and what activities are the most meaningful to you. These activities may take priority over less important activities. Examples of the things you need to do to stay healthy are things like getting dressed in the morning, brushing your teeth, eating, taking your medication, or even going to a doctor's appointment. Some things that might be meaningful and important to you are activities like calling a friend or a relative or getting out in the community. When you have multiple things to do, start with the most important activities. So, for example, attending a doctor's appointment may take priority over cleaning your home office. Break up your activities into smaller tasks and try to eliminate unnecessary steps or take breaks in between steps. When planning, think about what time of day you feel like you have the most energy so you can plan your most intense activities during those times in your day. Plan your activities ahead of time. When preparing for an activity, gather any supplies you need before starting to avoid taking extra trips to and from your workspace. For example, if you're preparing food, gather all of your materials and ingredients at the table before sitting down to begin. It is also helpful to keep a schedule. Plan activities throughout the week to avoid having too much to do in one day. Try to schedule demanding activities intermittently throughout the week or throughout the day so you can plan to take breaks before you feel too tired. Also, plan to get a good night of rest each night, especially before an eventful day. Lastly, plan to have support from family, friends, or care providers when you need to complete challenging tasks that may require too much energy. Remember, slow and steady wins the race. Do not rush yourself. Try to maintain a steady pace throughout your activities to avoid overexertion of energy. Rest when you need, and rest before you feel too tired. If you wait until you are exhausted to take a break, it can be harder to bounce back and get back into your daily activities. Try to alternate high energy activities with low energy activities, and give yourself time to rest in between tasks. It is also helpful to practice slow and steady breathing throughout your daily activities. Try to think about your breathing and avoid holding your breath. You can use pursed lip breathing to help you catch your breath and get more oxygen flowing throughout your body. You practice this by breathing in your nose for a count of 2 and out for a count of 4. When you're breathing out, imagine blowing out a candle on a cake. And lastly, make sure you listen to your body and know your limits. Think to yourself, am I giving my body enough support throughout my daily activities? One way to conserve your energy is to maintain a good posture by sitting or standing upright. A good posture can help open your airway and get more oxygen to your lungs and throughout your body. Also, sit when you can. Sitting is a great support that allows you to focus on your breathing and the activity at hand. Sitting down for an activity can actually reduce energy use by 25%. Try to avoid excessive bending and reaching because this can also cause fatigue. For activities that require bending and reaching, like getting dressed in the morning, try to use adaptive equipment like a reacher, a sock aid, a long-handled shoe horn, and/or elastic shoelaces to avoid bending and reaching too much. Finally, provide support for your elbows and forearms on a firm surface when you're working. For example, when preparing vegetables for dinner, sit down and support your forearms on the tabletop as you work. There are many ways you can apply some of these techniques throughout your daily occupations. When tending to your personal hygiene, like brushing your teeth or taking a shower, try to sit down when you can. You can also use electric toothbrushes and shavers to help limit energy use. Use adaptive equipment suggested by your occupational therapists, like a shower chair, grab bars, or a raised toilet seat. A long-handled sponge can also help you avoid extra bending and reaching in the shower. Also, try to use warm water and not hot water when bathing or showering. This limits shortness of breath caused by steam and condensation. When getting dressed, You can save time and energy by laying out your clothes the night before. Also, you can save energy when getting dressed in the morning by starting to dress your affected side first. You should also start by dressing your lower body first, because this typically uses more energy. Utilize any adaptive equipment like a reacher, sock aid, or shoe horn to help when getting dressed, and try to wear clothes that are easy to put on and take off. For cooking, it is helpful to plan your meal ahead of time. You can always make large meals and freeze extra servings for later. Or you can buy healthy frozen meals that are easy to prepare. Try to break down your recipes into smaller steps. You might want to prepare your ingredients first and then take a break before putting it all together. Remember to gather all of your materials ahead of time to avoid getting up and taking extra trips around your kitchen. You can also use lightweight cookware and electric appliances like can openers, blenders, food processors, and a dishwasher to help conserve your energy. We all know our housework can be physically demanding sometimes, but there are a few ways we can make this more manageable. You can always divide your house chores throughout the week and try to balance heavy tasks with light tasks. Focus on tackling one thing at a time. For example, when making your bed, make one side of the bed at a time. Take breaks and sit down when you need. When cleaning your house, you can focus on cleaning one room or one area of that room at a time. To avoid taking extra trips around your house, keep cleaning supplies in multiple places. Maybe try to buy more than one cleaning solution to keep on each level of your home. You can also keep a trash can in every room to avoid having to go to another room to throw something away. Try to ask for help from family members when you need. When doing laundry, sit down to iron or fold your laundry. You can also use a long-handled reacher to get items that are hard to reach in your washer and dryer. If it is time to get a new washer and dryer, consider switching to a front-loading machine. This allows the option to sit while loading and unloading laundry. Shopping can also be a physically and mentally demanding activity. Before heading out on a shopping trip, make sure to prepare a list so you know what you are getting, and try to organize your shopping by aisle to avoid extra walking back and forth from aisle to aisle. You can save energy by using a cart rather than carrying a basket. To manage your grocery bags, fill your bags only halfway full so it is easier to load and unload. You can also try to shop with a friend or a family member who can help you with any heavy lifting. You can also save energy by shopping during less crowded times. This makes it easier to move around the store and can be less overwhelming. Lastly, you can always consider a grocery delivery service to avoid making the shopping trips altogether. If you're experiencing overwhelming fatigue, it would be beneficial to reach out to your supports and work with your healthcare team to decide what approach may be best for you. Some other tips you can try are educating yourself and your family on the condition of post-stroke fatigue. Family support and understanding can be beneficial to your fatigue management. Try to communicate with your support system and let them know that post-stroke fatigue can be very overwhelming. You can also try to eat healthy and exercise to manage a healthy energy level. Also, try to consider modifying your environment at home and in the community when you can to make them more energy efficient. Also, if available, use adaptive equipment when you need. You can always reach out to your healthcare team to explore more options. If you think your medication is impacting your fatigue, check your prescriptions for their side effects and talk to your doctor. Ask your healthcare team about treatment options if you are experiencing anxiety, depression, or have difficulty sleeping. And lastly, talk to your physical therapists and occupational therapists about how fatigue may impact your fitness, balance, coordinated movements, and walking patterns. Practicing balance and coordination exercises can help you to perform tasks using less energy, increase your confidence, and decrease anxiety. Start by doing what's necessary, then do what's possible, and suddenly you are doing the impossible. Thank you everyone for listening, and I hope you can use these tips and tricks to get more out of your daily life. For more information, you can explore some of the resources below.